Hi folks, Dr. Ed Beyer. This week we're talking about fibromyalgia and chronic fatigue. It's kind of the topic that we chose for this week. And today I want to talk a little bit about why with fibromyalgia these patients are experiencing so much pain. You know, the first thing you need to realize is that pain is not pain until the sensations hit the brain. And what happens in fibromyalgia is that areas of the brain that perceive pain, no matter what type of pain it is, they sensationalize it, they exaggerate it. It's known as central sensitization. And this is one of the reasons, not the only reason, why people suffer from fibromyalgia. So in other words, you could have like a herniated disc or a problem with your knee, and in a normal functioning brain, you might perceive that brain may perceive that pain as a 2 on a scale of 0 to 10. Someone with fibromyalgia, the area of the brain that's perceiving the pain is not functioning properly, and that same 2 may feel like an 8 to that individual. Well, one of the areas, in fact, the first area, this is the model of the brain right here, one of the first areas, the first area to perceive crude pain in our brain is called the mesencephalon, or our midbrain. It's at the very top of our brain stem. Now, this is an area of the brain, it's kind of like our stress center of our brain, and it immediately is aware of any type of pain. This area of the brain, also the neurons are very sensitive to any type of chemical inflammation. When we have chronic inflammation in our body, no matter where it's at, this area of the brain needs to be aware of it, and it is loaded with receptor sites for the chemicals of inflammation, which are called cytokines. So what will happen, one of the underlying causes to fibromyalgia, to this central sensitization, or in other words, the reason why this area of the brain may over-dramatize the pain that a fibromyalgia patient is feeling, is because the patient is inflamed. So one of the first things we need to address in people with fibromyalgia or any chronic pain syndrome is underlying inflammation. And that can come from many, many, many different sources. I've been doing this for 28 years, and the first source that we always look at is the diet, because there are a lot of foods that create inflammation, and a lot of foods that we're eating nowadays are very different than the foods we ate 20, 30, 40 years ago because they've been genetically modified. Another source of inflammation are hidden gut infections or viral infections, even dental infections. So, you know, there are many options to someone who's suffering from fibromyalgia, but the first thing we need to do is to quiet this area of the brain down, and the best way to do that is by identifying and addressing underlying inflammation. I'm Dr. Ed Beyer. I hope that helps. Have a great day.